Today is Friday, and if it's 7 p.m. Eastern Standard Time, wherever you are, then you're going to be able to watch this live, this program, and you're going to be able to follow it. And I hope that you stay with me for the full program. It is very important because I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I try to convey important information, at least information that from my medical experience, I think it's important that you have it because it'll help you to be healthier, longer, and live in a much better condition. And we have really dealt with a lot of degenerative inflammatory diseases that have become a real epidemic in our time, and deadly diseases, incapacitating diseases, painful diseases, expensive diseases are coming to us that shouldn't happen, or should happen a lot later in our life. But we're seeing them more and more, and what worries me a lot is that we see them more and more in younger people. I'm a doctor, I'm a practicing physician. To this day, I come to the hospital every day, I see patients, I talk to people, I get on the phone, I get to see what worries you as a person with health issues, health questions, etc. So I'd like to invite you to join us and follow us on the website or follow us on the social media of your choice. Right now, there are so many that I think I'm beginning to lose count. But we're on Instagram, we're on Facebook, we're on YouTube and Twitter, Twitch, you name it. I tell you, I already lost count. So if I miss one, as they say, I'm very sorry, but believe me, you just have to go to the social media of your choice and be able to follow all this information. And what is very important, and to me is very important, it's a dear need, is that you share the information with other people. Because, as I tell you, we're living through an epidemic. Diabetes and cancer and heart disease and strokes and Alzheimer's and dementia, and all these things are happening more and more and happening in younger and younger people. So I have heard that even doctors, that when you say, well, we're seeing more cancer, we're seeing more of this, we're seeing more of that, they answer simply, oh, because we have better diagnostics, or because we're living longer. No, don't buy that. We're getting these diseases because we are doing something very wrong with our lives. I have to tell you a personal anecdote. I'm a person that loves cooking. There is a Spanish cook that always says that cooking is like giving love in spoonfuls. And I truly believe that. If you cook something you really like, you cook something with a lot of love, and then you share it with your family, that's very rewarding. That's fantastic. And because of this, I came to a book that's called My Kitchen, Ma Cuisine in French, from the first chef of the Ritz Hotel in Paris. And he's supposed to be like the father of modern French cuisine. And when you open the book, I was very surprised because I was with a total different intention reading this book. And as soon as I open it, in the first paragraph, it says, what we have to do is, when we sit to eat, we do it because we have to restore. We have to replenish all the elements and all the energy that a hard work day has produced. So that's where the word restaurant comes from. It's a French word and comes from restoration. In other words, you eat because you have a purpose. You have to do something in your body that's going to be replenishing, restoring, healing organs or cells or tissues that have been damaged, or simply to refuel. I mean, you do it with your car. You go 100 miles, 200 miles, 300 miles, stop. We have to fill the tank. Because if not, this thing is going to stop. And that's what this French chef says. He says, because if we don't do it, life will cease to exist, quote unquote. And yes, if we do not replenish what we're losing along the way, life is going to be extinguished. Well, I'm going to talk today about something that's in a very different area. And that different area that I'm going to talk about comes for a reason. As I tell you, as a doctor, I talk to many people, and one of my very dear patients, a person that I have known for many years, and that I'm very grateful because he trusts his health and the health of his family to me, he had a problem. And then he got oxygen at home because somebody told him, well, why don't you use some oxygen? You're going to feel better. And yes, he felt better. He was very happy that he did it because he was feeling better. And of course, in the conversations we had with each other, he told me, Doctor, is oxygen a medicine? And that's a very good question. Because we talk of medicine as normally as a substance, as something we get to try to heal or cure or change the progression of a disease, to fight it off. And is oxygen a medicine then? Because according to the description of the dictionary, we have to think. Do I use oxygen for what? Do I use oxygen to heal and replenish and to change the function of an organ? And I'm going to tell you in the following segments what I think of oxygen in human health. First of all, we have to begin with something that's very important. Life is possible because we have a small little furnace in each and every cell of the body. But that furnace, like any one you have at home, like your fireplace, like your gas range, like your pizza oven, whatever. Every time you have something to develop heat, you're going to use a process called combustion. You're going to have a fuel that's going to burn, and it's going to consume, it's going to use oxygen. And in turn, it's going to produce other gases. It's going to use the oxygen to produce energy, and it's going to develop some side products. God is perfect, mankind is not. So every time we burn fuels, we produce a lot of toxic things. We produce carbon dioxide in huge amounts. We produce a lot of toxic substances. However, the body is very efficient. It produces a lot of heat with minimal waste material. And that waste material, one of them is the carbon dioxide that's going to come out through breathing, and the other one is going to be water that's going to stay in your body. So we're a very clean burning machine, very, very clean. So we do not produce any sulfur compounds. We do not produce carbon monoxide, which is very toxic. That's what the exhaust of your car produces. That's why you can commit suicide just by breathing that thing. Or that's why people, in some places, they have a furnace at home, and next morning they're dead because carbon monoxide intoxicated their lives and killed them. We don't do that. You can live with an army of people around you. You will never get intoxicated as you would from a very simple furnace. So, because we are very efficient. And that oxygen is going to help us to burn some of the food that we consume, mainly carbohydrates, and produce energy. What we need energy for? Well, the first thing, it's very simple. Touch your skin, touch your face, touch your cheek. They're not cold. Actually, when somebody dies, the first thing you notice is this person is cold. Why? Because he's not generating any heat. So the first reason we burn carbohydrates in the body with the use of oxygen is because we have to develop heat. Because we are a heat-dependent organism. Every reaction within the body requires a certain temperature. And the body is going to try to keep that temperature no matter what. You can be in the desert. You're going to be 98. You can be in the North Pole. You're going to be 98. Because if you go down, first you're going to do miserably, and then you're going to die. If you go up, the same thing. We have a very narrow margin within the body works. In that margin, everything happens. We can produce biochemical reactions, we produce enzymatic activity, we produce antibody actions, we produce immunity, we produce hormonal, we produce every single function of the body. So we need that oxygen to help those little furnaces to burn carbohydrates and develop heat. So the first important reason for us to need oxygen is to be able to keep the body at a given temperature, to develop heat. Very simple. And say that, I want to give a little margin for you to think and reflect on this, and I'll be right back with you. We're talking about oxygen. What about that? We're not talking about food. We're not talking about an illness. We're not talking about a supplement. We're talking about oxygen. Who would have thought of that? Well, I tell you, a really loved patient of mine, he asked me that particular question. Is oxygen a medicine? Then I have stopped to think, and I said, well, what a medicine is in the first place, before I can answer. And I read it from the dictionary. It is a compound or preparation used for the treatment or prevention of disease. So it's something you get either from the pharmacy or you prepare or whatever, and you take it for the management of a disease. That's what a medicine is. But we think of a pill or of an herb or capsule or you name it. But we don't think of breathing in and breathing out. So the question is, oxygen is a medicine? Definitely yes. Because we know that if we have any problems with metabolic problems in the body, oxygen will come to a rescue. We're talking about heat production. We're talking about using oxygen the same way your fireplace or your gas range uses oxygen. You give it a vent, and then you burn something. You can burn coal or wood or gas, whatever, but you need oxygen. If you cut the oxygen, that fire is not going to exist. We did it in school. When you are in elementary school, you put a little candle in a little glass, and then you see the flame, and you cover the glass, and the flame will extinguish because oxygen is not there any longer. Well, you can do that with a plastic bag. You can put it around your neck. There's no oxygen. Life will extinguish. Now, remember something very important. We can probably live without food for weeks. We can live with no water for days. But you only need 2 to 3 minutes without oxygen to lose consciousness, and 5 minutes altogether to be dead. That's how important, that's how urgent the oxygen supply to the body is. I mean, when you drown in a blink of an eye. You say, but I saw him swimming, he was jumping, he was having fun, and all of a sudden I couldn't see him anymore, and then we found the corpse. Takes a blink of an eye to lose your life because of the lack of oxygen. So think of that so you understand why breathing is so important, how cigarette smoking is so bad, and why doing anything that's going to block that breathing or the quality of your breathing is going to be deadly. We have seen it in COVID. Most people that died because of lack of oxygen, not in the lungs. That's why respirators didn't work. They couldn't get the oxygen in the cells to fuel the little furnaces we have in every cell. Because oxygen enters your lungs, you know that, and then enters the red blood cells. And the red blood cells are going to flow through the whole body, once again, delivering life. Life is in the blood. So that blood in circulation is going to go to every single cell of the body. And it's going to produce, it's going to make possible that burning of those carbs to happen, and you're going to have energy, and you're going to have a lot of good things happening in your body. If for any reason blood supply is slowed down, we're going to have a real problem, because oxygen and nutrients will not be able to get to that area. And you see it, for example, on people with diabetes, when they start developing a diabetic foot or a diabetic ulcer. What's happening there? What's happening there is that because of the disease, because of the inflammation of the blood vessels, blood cannot go to the furthest places of the body. That's why the feet are the normal victims. You never see diabetic ulcers in the hands or the chest because they're too close to the heart. They're too close to good blood supply. But the feet, yes. That's why you complain. When it's cold, we complain of cold feet because the feet have the least blood supply than anywhere else in the body. So we have to take care of that. If it's cold, make sure you have warm socks and shoes that will not have any humidity. Remember that water will rub temperature in huge amounts. So if your shoes are wet, beware. You could have a problem. And next time you buy sports shoes or next time you buy winter shoes, etc., make sure that not one drop of water is going to leak into the interior. That in itself is going to keep you much better. Well, when you don't have good blood supply, what happens is the cells begin to degenerate and finally die. And what you see in an ulcer is a piece of skin that has died and fell off. That's all you're seeing. Now, people tell me, can I use this ointment? Can I use this cream? Can I use this thing? No, what you need is to improve the circulation to that area. How? Keep those feet warm. I tell many people, just get in the bathtub. Put it at a nice, warm temperature and sit in there. I don't know how many of you remember the Reader's Digest. And I'm going to tell you something. When I began my medical career, when I told people go to the bathtub, my measure of time was the Reader's Digest. And I always told people, get in the bathtub, get your Reader's Digest, and read a couple of articles. Why? Because they're going to take about 20 minutes, 30 minutes time. You will not be bored. You're going to not be counting the minutes because I want to get out. And if for any reason it falls on the water or it's damaged, it's inexpensive. All you have to do is put it in the sun and it'll be dry next day and you can use it again. I used a lot. I said, you have the Reader's Digest? Yes, okay. Get in the tub, put your little magazine on the side, and then start reading. That's going to keep your mind busy and it's going to give you... right now, I don't know what to tell people because I would not advise you to get there with your cell phone or with your tablet or anything like that. So we have to think of something else. So after all, those good old times were very good. Well, when you do that, then you improve the blood flow to the area. And as you improve the blood flow to the feet and to the legs, everything is going to start to heal. Everything is going to start to happen. So if you're diabetic, if you have any of those problems, make sure you review your feet. Make sure you review the quality of your skin. Make sure you lubricate your skin. Make sure you sleep with socks. Don't let your feet get cold. Don't let them get cold. If you're going to bed or you're in bed in the middle of the night and you touch your feet and they're very cold, get socks immediately and sleep with socks. And the other good advice, look for real wool or real cotton socks. Only natural fibers. Do not use nylon, do not use microfiber, do not use anything artificial, because once again, God made things in perfection. And for a reason, real wool and real cotton can provide the best care that your feet or any part of your body can have. So go for that. Don't go for synthetic fibers because they can irritate. They can produce problems. So use the real stuff, something made by nature, something made by God. And all this brings me then to other important situation, which is physical activity. When you think of physical activity, we all say, oh, that's good for you. Yeah, but why? Why going and walking? Why going to the gym? Why getting on a bike? Why mowing the garden? Why vacuuming my house can be good for me? Because you increase the amount of oxygen that each and every cell of your body is going to get. And you increase it because when you start increasing the demand for energy in the body because you're physically doing something, your heart is going to start pumping faster. And your heart is going to start sending more blood. And the blood is going to flow faster and better. And when all that happens, then everything starts to work better. What happens when you exercise? Wait 10 minutes, 15 minutes, 20 minutes at the most. And then you start throwing off all your clothes. Then you start getting sweaty. Then you start gasping for a little bit of air. Everything, all that magic starts to happen. And that means that the body temperature is trying to be higher. So we start sweating, detoxification, but we are, that increase in heat, that increase in blood flow is going to increase your immunity, is going to increase your enzyme activity, is going to increase your being able to fight with foreign things, is going to help you to build up your body better. So there are a lot of good things that are going to happen simply because you're delivering a lot more oxygen to the body, because that physical activity demands it. Doesn't it sound a lot more logical than just think that move because it's good for you? I hate that phrase, by the way. I hate to say do this because it's good for you. I like to try to explain why it's good for you. And physical activity is going to be so good for so many things that nowadays it is considered that a cancer program, a cancer treatment program, should include some form of physical activity, because it's going to increase a lot of things in your body. Don't go anywhere. I want to keep on talking with you. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I'm very happy that you're there, very happy that you're listening. I actually want to thank you for hosting you in your house, in your workplace, in your radio, or on the TV. You know, we come to you through the courtesy of Truth Be Told Radio Network. And we broadcast every Friday night at 7 p.m. Eastern Standard Time. And if for any reason you miss it, we are going to broadcast again Saturday morning at 9:30 a.m. Eastern Standard Time. But you can go to Spotify. And when you go to Spotify, you can search Truth Be Told Radio Network, and you're going to find a lot of programs like this, a lot of, I wouldn't say a conference, but I would say a one-to-one talk in trying to show what I think of health, what I think of self-care, what I think of medical care from my perspective. And my perspective is much more holistic, much more general than just the close vision of this is a disease, this is the drug, you go to the pharmacy, gets cured. Simply because I have seen over 50 years of medical practice that that's not true, unfortunately. I don't say it doesn't work, I don't say it's bad, I think it needs a lot more. And what's more important is that it needs you. That's something that I am absolutely convinced of. If you think you have a disease, you go to the doctor gives you a prescription, you fill the prescription, they give you the drug, you take it, you're safe, think again, because that's not going to happen. Medical care, disease management, health care needs you at the helm of everything. It needs you to think of what am I going to eat? How am I going to breathe? How am I going to exercise? What I'm going to do with my life? What drugs I'm going to do? What questions I'm going to ask my doctor? And so on. But you have to be a very important part of this thing. You have to be involved. And in the last decades, and I tell you because I lived as a doctor through those decades, patients didn't have a say-so. You went to the doctor, you sit across the desk, I tell you what you're going to do, and you do as I say, period. And you don't dare to ask a question because it's going to take you 4 years in the university to understand what I already know. All that is completely false. I tell you, it's exactly the opposite. That's why I like to talk about all these things every Friday night on Truth Be Told Radio Network. But also you have it in all these social media because we live stream to all social media, to Twitch, to Twitter, to Facebook. You can just go to your media of your choice and tune Dr. Rodrigo Rodriguez, BioCare Hospital, and you're going to find me. And it gets better because I want you to join us. I want you to follow us. I want you to ask questions. Send me your comments. I'm not asking you necessarily just to listen and do as I say. That goes against everything I'm saying. No, I want you to think. Well, I think this makes sense, or I have a question about this or the other. Send me your question. Send me your comment. Send me your doubt. We can establish a conversation that's going to let us get the truth, or at least get closer to the truth. Because there's only one that has the absolute truth. And that's not you, that's not me. But we can get closer to the truth. So please, make sure you join us and make sure you share all this with somebody else. There might be people that get benefit from this information. So we're talking today about oxygen. And it is a very special thing because oxygen is not a drug, it's not a substance, it's not anything like that. But it's a very important part of everything that happens in the body. First thing is heat production, and we have discussed this, I think, in a very good way. Any questions? Send them to me. But oxygen does a lot more things. And right now with COVID, there, in every big problem, there's always to be learned. And with COVID, we started looking at a phenomena that's called long haul COVID. In other words, people got the disease, and then afterwards, they had a lot of mainly neurological symptoms. And those neurological symptoms affected not only the nerves, but also the muscles. In other words, organs that need the spark to function. Do you follow me? That's very important. Organs that need a spark to function. Which are those? The nerves that act like electrical cables in the body, and the muscles that move through an electrical function. And we saw that people after COVID many times were very weak for weeks, for months, or they were fogged. That was a very common word. People said, I'm like foggy. I cannot think clearly. I cannot see clearly. I cannot think the right way. They had pains, aches, a lot of these symptoms, all of them neurological. And we started reviewing, and by we, I mean the medical community. Because it's not me, it's the whole world trying to find out what is happening. And what happened was, if you are in my generation, you can remember the difference it made when you fix your car, when you send it to a tune-up, every time you cleaned and recalibrated the spark plug. Don't you? If you're in my generation, you remember we did that. Every time we felt the car was dull or not delivering what it used to, we opened the hood, and then we took the spark plugs and cleaned them, and then there is a little gap that had to be calibrated. And we calibrated that gap, and then everything worked fine. And we could feel it. You could feel the stamina, the torque, the everything of the car. Well, that's what happens in your body. Oxygen provides the spark to nerves and the spark to muscles. If we don't have oxygen, if we don't have good supply of oxygen, that's not going to happen. So we started new programs to handle long-haul COVID, and all of them involved oxygen. And the results were very good. As simple as oxygen. You see, so the question again, is oxygen a medicine? Yes, it is a medicine. And it can do wonderful things for you. So we have to think of all those things every time we take a deep breath, every time we do these things. Because actually, humankind has used oxygen therapy for years, for ages. In the old years, people knew that fanning the sick was good for them. They didn't have oxygen, but they had fans. So every time somebody was very sick, they used to fan the person. You remember the expression, don't get too close to a sick person because you rob their oxygen. You opened the windows every time you could. And there were specific hospitals or healthcare centers in the forests or in the mountains, for example, for people with tuberculosis that had a lung problem. So they could breathe and function better and heal faster. So oxygen is a definite, very important part of life. And once again, it's going to take you a few minutes without it to be dead. And with water, you're going to take days, and with food, you're going to take weeks before you really go into trouble. But with oxygen, there's no way out. It's going to happen very fast. So this all information is very important to keep in mind. That's why the first thing you have to do is take care of your lungs. Take care of your heart. And make sure you exercise them. How do you exercise your lungs and your heart? By doing physical activity. But engaging yourself in doing something that's going to raise the demand of oxygen in the body, because the body has sensors. The brain has a lot of sensors. So you start moving, and your brain is going to say, they need more oxygen, just like a computer, and it's going to tell the heart, we need more blood, so start pumping faster. So the blood is going to go through the lungs in a more frequent way and produce a lot more oxygen supply for the whole body. If we do that, we're going to be in better shape. We all have seen in the news people that they say, in the last marathon, we had people running at 75 years old, 80 years old. They, oh my God, they're in good shape. They can still do it. It's the other way around. They got to be 75 and 80 in good health because they exercise. They don't exercise in spite of their age. They exercise. They got to that age healthy because they exercise. So think of it next time you want to take an elevator or park right to the door of the shopping center you're going to. Let's move. Let's do something. Let's make sure we take deep breaths because our body demands more oxygen. You're going to be a lot better. We still have more to tell you, so don't go anywhere. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And we've been talking about oxygen. We have talking about how important it is. And we have stated that yes, in answer to my friends and patients' questions, yes, oxygen is a medicine. Why? Because it can change the way we manage a disease. It can change the way a disease happens, and it actually can prevent disease. So all that makes oxygen a medicine. A very special kind, because that's not a medicine that you have in a pill or in a shot or anything like that. Nevertheless, it can manage an illness. It can help you to manage that illness. So with all that said, then you say, okay, doctor, and what you do at BioCare? What you do with oxygen? Because of course we're talking about exercise, we're talking about physical activity, we're talking about keeping our lungs clear, our heart in good shape, etc. We talked about problems in the limbs, particularly the feet, in diabetics and so forth because of lack of circulation. Yeah, we have stated all that. But now I go to the hospital, I go to BioCare Hospital. And what do you do? Well, I have a big advantage. I run a real hospital, a licensed hospital with licensed physicians, medical doctors, licensed nurses. So I have a professional team to do a lot of good things and take advantage of that oxygen. I have excellent supply of oxygen, very good quality, and then what am I going to do with it? Well, I can use it in very simple ways, like using nasal oxygen, the one that you have seen it. Which, by the way, brings me to the fact that in some places of the world, Japan in particular, people use pure oxygen to catch up, to feel better, and so forth. That is a medicine. And yes, it can do good. So people ask me, do you get an oxygen concentrator? Well, it depends on your age and circumstances, but yes, it could be a good help. But ask me. Well, it's going to cost you nothing. Ask the question. This is my situation. This is what I have. Should an oxygen concentrator be good for me? And I'll be very happy to discuss it with you. And we can even get on the phone and talk about your conditions. What we do at a hospital? Well, it gets more complicated like that because we have two things. One is oxygen, the gas that we all know about, and the other one is what we call the oxidative therapies. What is an oxidative therapy? Well, you do not necessarily have to give a patient oxygen. You can give a substance that's going to deliver oxygen within the body. A good example, for example, is ozone. Ozone is a different molecule than oxygen. That's why it has a different name, but it's oxygen. The molecule of oxygen is two oxygens together. So you will normally see by the symbol O, which is the oxygen, and the number 2, which means it has two atoms of oxygen together. Oxygen like that, completely separate, does not exist in nature. That's called nascent oxygen, and as soon as it's produced, it's going to look for something to attach. Oxygen is eager to attach to something. That's why, for example, if you live in an oxygen-rich place, like by the ocean, you're going to see that metal oxidizes very fast because that nascent oxygen is going to attach to the metal and produce the rusting that we all see. But in general, when you use this sort of manipulation of the oxygen, you can deliver it within the body in a very important way. And ozone, which is O, again, the symbol of oxygen, and the number 3, will, once in the body, release oxygen and becomes O2 free oxygen that's going to last very little, that can have a very important effect on a lot of things. One of them is infections, because infections hate oxygen. You know what else hates oxygen? Cancer. Cancer runs and lives in low oxygen environments. That's why smokers or people with circulatory problems have a higher possibility of developing a cancer, because they have areas in the body with very poor circulation. How you overcome that? By using ozone. Ozone, it's given to the person. The ozone is going to get in the blood, and it's going to be released, nascent oxygen, at very different levels of the body. So we use it a lot. And it can be administered different ways. Again, we're a hospital. This is not a doctor's office, or this is not just a small clinic. It's a full hospital. So we can do a lot of very good things because we are licensed to do it. Another fantastic way of delivering oxygen to the body is by using 100% oxygen at a higher pressure. That's what we call hyperbaric oxygen. Hyperbaric oxygen was born because when people dive and come up, they release a lot of gas within the blood, and they could die. So what they did is they built some chambers. So you go in, they're pressurized, and then they brought back to normal pressure little by little, and that gives the gas that's in the blood time to be released without a problem. Well, you can do the same thing for medical reasons. If you use 100% oxygen at, let's say, 2-3 atmospheric pressure levels, multiplied 2 times or 3 times, you're going to see that oxygen is going to go to more difficult areas to reach. If you have a circulatory problem, if you have a mass of a tumor, if you have any of these things, it's going to work a lot better. So hyperbaric oxygen is another way. And also, if you have Lyme disease, if you have chronic fatigue syndrome, Epstein-Barr virus, and those type of things, and even on the residual long-haul COVID, it's going to work fantastically well. So once again, that oxygen is going to be your medicine, because that oxygen is going to reach places that normally you do not reach, and you're going to reach concentrations you couldn't get otherwise. You couldn't get just by breathing normally. And you're going to speed the recovery of a disease. We have used for many years, and we have proposed for many years, the use of certain molecules that, when given to the person, also release oxygen. There are many things that release oxygen when in contact with the tissue of the body. And that oxygen release is also going to help us to deal with a lot of diseases. And once again, I want you to think of 2 major situations. One is cancer, and the other one is infectious diseases. Some infectious diseases are really hard to deal with. And one of them that it's becoming more and more frequent is Lyme disease. You know, this is a microbe that you get by the bite of a tick that's going to be very stubborn, and in some people can create serious health issues, because you lose your energy, you lose your stamina, you lose everything. And the worst part is that it happens many times in young people that were working in the fields, or young people that were going through just doing senderism, just hiking. And those people have those problems. If you're going to hike, make sure you wear boots and you cover completely your ankles. It's going to cost you nothing. It's going to be no effort, but you're going to be more protected both from the stability of the bone, but also from the possibility of Lyme disease. Lyme disease is stubborn, is difficult, it's long-lasting. But hyperbaric oxygen and oxidative therapies are one of our best tools to deal with these microbes because they're tiny. They're not only tiny, but they do not respond to the normal antibiotics because they're not bacteria. Bacteria are one thing. That's what we treat with penicillin or with any antibiotic. That's what you get with your sore throat or that type of thing. But this is completely different. And same with chronic fatigue syndrome because you have the Epstein-Barr virus. What about Candida? Candida is a fungus. So all these different microbial lives require more imagination, need more creativity in how you are going to deal with them because we know antibiotics will not work. So we work two ways. One, with oxygen, hyperbaric oxygen, and oxidative therapies to deal with the thing. And on the other hand, to enhance immunity. Most people that develop these things is because their immunity has gone down for whatever reason. And that reason many times is quite obvious. We're seeing more and more people being born through C-sections. We're seeing more and more people that are not breastfed. We're seeing more and more people that are given antibiotics early in life and for long times. For sore throats, for respiratory infections, for acne, you name it. The fact is that some people are on and off antibiotics all their lives. So they really damage their immunity. And when they are in their 40s and 40s, they all of a sudden start develop all these weakness and symptoms and tiredness and you name it, and they don't know what's happening. But we have to do something. We have to see them. We have to help them. And oxygen is one of our tools. And I could talk for another big segment about what you can do with the immune system. But today we're talking about oxygen. So any question, any symptom, any problem you have, we're only a click away. Email me, follow me, ask me. No strings attached. I'll be very happy to talk and discuss with you any medical question you have. Until next Friday, I'm Dr. Rodriguez.